I don't know if it's the weather or what, but yeah, just a bit slow.
Right, okay, well, I've got it as 12:32, so let's kick off. So once again, thank you all for attending our Learning Lunch webinar today. Today's webinar is titled Supporting Integration and Transition for Internationally Educated Nurses into the UK Healthcare System. Alongside me, we've got Linda Whiteley, who's a development coach for Herts and West Essex ICS, and she's going to talk about the Eastern approach for creating an app using the Piota platform in order to be able to help integrate and help the transition for their internationally nurses. So let's just kind of get started. Before we start, I might say my name is Chris Elkin. I've been in the industry for 20 odd years. I've worked for the NHS for a long time. And my real interest is making people's lives easy using these technologies. So we've all got mobile phones. We all use them all the time. There's absolutely no reason why we shouldn't be using these apps for colleague engagement, for patient, families and carers engagement. I mean, let's be honest, everyone's got a phone. If you look around any sort of, social environment, or if you look at any of your sort of waiting rooms in your outpatient clinics, everyone's using phones. So, as an organisation, why wouldn't you want to use the phones at the same time? I would say we're a leading provider of NHS, support apps to the NHS. We've got over 140 clients at the moment, ranging from NHS England, Public Health Wales, ICSs, Cancer Alliances, all the way down to individual teams within individual trusts, and everybody along that spectrum. So I'd like to pass over now and thank Linda again for helping us out with this webinar today. So Linda, over to you.
Lovely. Thanks, Chris. And thank you both, yourself and Laura, for inviting me today. So as Chris said, my name's Linda Whiteley. I'm a career development coach for internationally educated nurses in Hertfordshire and West Essex integrated care system. So as it says, I cover the whole of Hertfordshire and a little bit of Essex. I'm a nurse background. I've been a nurse just coming up for 40 years, and I retired a couple of years ago and have come back to do specifically this job part-time. So I've been in post for 2 years now, and I've got sort of two elements to my role. One is the career coaching for international nurses, and then the other bit was around developing a virtual careers support of some sort, so hence the app. So I don't know if Chris, you could pop up the slides. I won't go through all of the slides because some of them, it's a combined slide deck for both the development coach role and the app, but I won't talk about the development coach role other than how it's supported the app development.
Okay, so on the background slide now.
Yeah. I can't see them.
You can't see them?
No.
Can you see any slides, or have you been able to see any slides so far?
No.
Everybody else see the slides?
No, sorry, Chris, nothing coming through.
Right.
Okay, well, Chris is doing that. I'll do a little bit of background because, to be honest, I've done the slides quite a few times, so I could probably talk them off by heart anyway. So if I just give you a background to the role, and then that sort of also, sort of like say, it supports the app development. So the East of England region are looking to have recruited about 5,500 international nurses by 2024. Res data from 2019. Thanks, Chris. There we go. So yeah, res data from 2019 suggested that internationally educated nurses were less likely to be promoted at the same rate as UK educated colleagues and less likely to access CPD. And obviously, if we've spent the amount of money we have looking at, it's about £10,000 per international nurse. It's a lot of, huge amount of resource, and therefore it's critical that we keep the nurses, not only from a financial perspective, but also the NHS needs a sustainable workforce going forward. So we took the opportunity to look at how we took that in and operationalised it into a career service. Next slide, please. So actually, so one of the aspects was to create a mobile phone app. So if you want to skip to the next slide, Chris, please. Yeah, and the next one, that's very much around what we sort of looked at. And the next one. Okay, so to begin with, we started developing the app from a Herts and West Essex perspective. We had an app developer, and he started creating almost a prototype. And then in August last year, we were successful with some national funding, which enabled us to look at how we took the app and developed it further, which is where we then worked with Piota. There was a lot of interest across the east of England, and our ICS colleagues, workforce colleagues, also agreed that this would be a really good step forward. So we collaborated across the east of England, so with the 6 integrated care systems. All of the integrated care systems bar one had development coaches for international nurses. So we had a really good sort of network of support in terms of how we built the app and what content we put in. How did we decide on the content? So whilst we were all having those conversations with the international nurses, what we began to realise is actually it wasn't just about career development, it was about all the other things about living in the UK. So accommodation, looking at how they start developing and accessing different training. There was a lot of cultural issues, there's a lot of health and wellbeing issues. Some of the nurses were quite understandably homesick. Some had families back home that they hadn't necessarily been able to bring over until they'd got their PIN numbers. There was like I say, cultural things around working on the wards, not just around what it looks like to work in the NHS, but just not necessarily having the same access to support networks, perhaps out in the community. So maybe cultural groups or religious churches, things like that. So what we then realised was actually this wasn't just about supporting the nurses to develop their careers, develop academically, perhaps get a band 6 or higher. Whilst we've got new nurses here, we've also got some international nurses who've been here for 10, 15, 20 years, and some of those, yes, have progressed, but others haven't. So that's where we started looking as to what information we put onto the app. The other thing we had was, particularly in Hertfordshire and probably some of the other home counties, you'll be able to understand this, is that we have obviously nationally we have a cost of living crisis, but we also have very high accommodation costs. Renting a room in sort of Hertfordshire can be up to £650 a month, which is actually significant when it's just one room. And some of these nurses are clearly looking for houses or flats where they can eventually bring their families. So that's really how we then started looking as to exactly what went onto the app and looking at the different areas on the app that we could look at. Next slide, Chris, please. So the aim of the app is, as Chris said at the beginning, is sort of to increase access to career development, support pastoral care for internationally educated staff by providing digitally driven information and resources all in one place. And it was specifically around living and working in the UK. Next slide. So as I've just explained some of the areas we've looked at, so we looked at welcome and support information prior to arrival in the UK. A lot of the trusts have welcome packs that contain loads and loads of information for the nurses around when they arrive in the UK, so things like accessing banks, SIM cards for their mobile phones, information about the trust that they're working in. We have particularly in Hertfordshire, we have a voluntary organisation that supports our international nurses with a buddy scheme. They provide day trips out to the local area once they've sort of got here, and it's just about sort of networking and supporting them as a group. It was about enabling staff to establish foundations for living and working in the UK. As I said, families sometimes want information about schools. That, you know, they're bringing their families over, they don't know where to start looking, and that's what we've been able to put on the app so that we can signpost them to that. Another example I've had was an international nurse just before the summer, actually. She was bringing her family over. Her mother was coming to look after her son. Unfortunately, her mother's visa was declined. Her son's visa was accepted. So she had to go back home to pick her son up and then come back. She asked for some support. He had some learning disability or difficulties, and part of my role was to be able to look at different support groups, summer holiday childcare, voluntary organisations that could support the particular learning difficulty that she had. And whilst that information is not on the app, that was a very specific things like accessing special schools and putting her in contact with the council, the county council, because clearly she would need a special educational needs assessment. So, you know, it was that sort of information that really supported that nurse. To be honest, I don't know what she would have done. I don't know where she would have found that information. Maybe she would have got it from sort of somebody, a colleague at the hospital. As we talk to nurses, we begin to identify gaps in any advice and support they receive, and then we're able to add that to the app. And Piota have been really supportive in looking at how we do that. Chris, in a minute, we will look at how we've set our app up, because I think it's slightly different to how other organisations have used it. As I said, the information includes advice, training, development resources, learning opportunities, wellbeing support, signposting, success stories, news and events. Apologies, I've got a little person running around today. So, next slide, please. So this is the Intern app. This is how we've set it up. So this is our front page. Please. Right. Yeah, so this is our front page. So these are sort of what we call generic information. So this is available to anybody, doesn't matter where they work, and it's relevant to any person working in the UK. Come here. Sorry, come here. Come here. Okay. Sorry. So what we then did is, because we have six integrated care systems in the east of England, we wanted to start drilling down to that local information. For example, Herts and West Essex have their own health and wellbeing service, which wouldn't be relevant to, say, a nurse living in Norfolk and Waveney or in Bedfordshire, Luton and Milton Keynes. So what we wanted to do was to start layering the app, and you know, Chris and his team were really supportive in how we actually facilitated that, which we were able to do. So when we click on where do you work from the front page, it takes us to our 6 integrated care systems, which are also pretty much the counties in the east of England. When you click onto that, it will then drill down to some very specific information. So, for example, on this slide, we've got development coaches. The development coach for Herts and West Essex is obviously different to the one in Bedfordshire and Luton and Milton Keynes. So we've got information there about what we do, how to contact us, mugshots as well. And we're fortunate enough, we had 2 career development coaches for nurses. We have one for midwifery, and we had one for AHPs. Unfortunately, she's just moved to a legacy role for AHPs. So all of that information was on our development coach bit. In terms of other local information, so we've got all of the 5 trusts in our ICS, so that's 3 acute trusts and a mental health trust and a community trust. When you click onto that, it gives very local information in terms of who to contact in the trust. For example, the international recruitment team, OSCE, nurse education, learning and development, pensions, payroll, EDI lead, Freedom to Speak Up Guardian, our chaplaincy, and that's really very trust specific, but it just enabled a nurse to access that without kind of thinking, who do I need to contact? Where do I find their details from? Other aspects of the particular area, we've included our own health and wellbeing information. We've included local transportation information. So, for example, bus routes, trains, TfL, as we're fairly local, near to London. We have information around training and resources specifically to Hertfordshire and West Essex, but also nationally. So, for example, one particular trust may have may signpost out to the Edward Jenner leadership programme, but you can also access that from the front page as well. So it's really it's a one-stop shop, I guess, for anybody who wants to access it. We also have international midwives and international AHPs who obviously their pipeline, we're not recruiting as many, but we've also looked at how we start developing the app to support them as well. You can see there, Chris, we've got UK words and phrases. It's something that comes up quite a lot, that international nurses, sometimes in their own language, don't have a translation for a word we use in English, and also some of the phrases that we use. And I always have a bit of we have a discussion in my preceptorship teaching sessions where one of the most common one is knickers, apparently. They don't use the word knickers in the Philippines. So when a patient says, oh, can you get my knickers? They don't know what they're talking about. So it's just things like that. I want to spend a penny, things that we use here, but aren't necessarily familiar in overseas. So where are we now? So as we've said, the prototype started over a year ago. The name of the app, Intern, was we held a competition around March last year for a name to give our app. We had I think it was over 60 entries. I had to go through Google and Apple Store to look for any apps of the same name. So we excluded quite a few of those. Amazingly innovative, creative names. There were some really, really good ones. Intern was chosen, and one of our nurses from one of our trusts won that competition. Let's say the content came from discussions with IENs around their challenges, their experiences, and what sorts of things would help them. Another example, on our FAQs, one of the nurses said to me, she arrived in the pandemic, and she said, I wish somebody had told me that I could drink the tap water. I was going to the supermarket every week, carrying 2 5-litre bottles of water home, and then had to go back and do her shopping because she didn't know she could drink the tap water. So something so simple that we all take for granted, that will just make that nurse's life just that little bit easier when they're here. So we've continued to access funding. We launched our app in June. We soft launched in May. We have just hit, I think the last look was 1,111 downloads. And we have also just received some funding from the national international recruitment workforce team, and we are working with 2 colleagues, one from Southwest region and one from Northeast and Yorkshire, and we are rolling the app out nationally. So we're looking, in fact, Chris and I met with them yesterday, sort of tea time yesterday, and looking that I will do, Rachna will pop that into the chat box shortly, asking for the link. yeah, so we're working with the national team, and we'll be looking to roll it out for South West and North East Yorkshire, hopefully by the end of the year. We have demos all set up ready for all the other regions. So really, really exciting. Working with Stay and Thrive. I'm sure some of you will have heard of Stay and Thrive, which is sort of a project that looked at international recruitment. So we're working closely with them, and we'll be looking at how, or already looked at how, the Stay and Thrive pillars are sort of threaded throughout the app. So yeah, the regional project team, that's ongoing. So they were key stakeholders in how we developed our app across the region. Obviously, we've engaged with Piota as well. And like I say, we launched on the 7th of June. Next slide. Yeah, so one of the big things we're being asked for is the impact and benefits. Like anything in the NHS, we like to know what impact are we making? Is it making a difference? So we've literally just finished creating an app, not an app, a form within the app, and I will be sending that out with a notification. So we'll sort of publish it with a notification that will go out on the app, so that any users will know, you know, please let us know what you're thinking, and yeah, how has it helped you? Really, just so that we can look at the retention bit, as well as, you know, how has it helped them settle and in working in the UK. Talked a bit about the extending the information for AHPs and midwives for inclusivity. I was on a meeting this morning. One of my colleagues is looking at a midwifery sort of toolkit across the east of England. So we'll be looking at how we can incorporate some of that information onto the app as well. I had a meeting last week, week before, with our social care colleagues. They have just received, again in the east of England, quite a large sum of funding around international recruitment of both nurses and social care workers. So yeah, and then the funding, as we've talked about, working with Stay and Thrive. So yeah, it's been a journey, as you can imagine. The app will never be finished, because the more information we get, in fact, I received something this morning from Unison, so I need to get that onto the app, into our union information for them, and that was around international workers. So, you know, as soon as I get the information, I can put it on the app. It takes minutes. It's a really easy app to use in terms of back end. Hopefully the nurses find it useful and easy to navigate, you know, to support their living and working here. This is some of the feedback. This isn't just about the app, it's about some of the work that we've done as well. So again, there's one at the top there. The app is consolidated, very helpful information, all under one umbrella. Whether the information is needed at the initial phase of settling down, such as housing, childcare, etc., or career development, which comes after, it's an invaluable must-have guide. One of my trusts is actually sending the link to the app out with the contract, so before the nurses even arrive in the UK. So as Chris said right at the beginning, we all use our mobile phones, we all use apps. So yeah, it's free, don't have to register with it, it's available to anybody. So there's the download information. I will put our, in fact, actually, if you've got your Piota poster, Chris, perhaps pop that in with the download information. Okay, yeah, I can send that. Linda, thank you ever so much. That's been fascinating. That's been really, really good. Yeah, give us a real sort of a deep dive into the whys, you know, wanting really to look after your colleagues, making sure they've got the information they need when they want it, making it easy for them to access.
I think I kind of blobbed one of the slides up showing that the app has actually got translation functionality within the app. So if English is not your first language, then you can happily translate that into different languages, which I suppose for your audience that has families that where English may not be the first language, they've got the ability to use the app as well, haven't they? And to learn more about what their nearest and dearest is get involved with. So Linda, thanks ever so much again. We'll put some information in the chat, and we can certainly share this information if people want to download the app and have a little look at it a little bit later on. I'm just going to finish off now a little bit about and talk a little bit about the solution itself, just to put some context around how it all kind of works. As Linda said, it's relatively easy to create. We've got two aspects of the app. We've obviously got the app itself, which can be customized with your logo. We can start thinking about the sorts of information that you're wanting to provide to your audiences, and make sure those tiles, which is essentially a menu system, are intuitive. They've got an icon, they've got a label. The whole idea is once you've downloaded this, you can pull the app out of your pocket and navigate it without having to think about it too much. In this busy world, we're at 1,000,000 miles an hour. If you don't have to think about it, I think you're more likely to do it. If you've got to stop and think about something, you probably stop and think about something else. On the left-hand side, we've got the app editor, and this is a sort of web-based, cloud-based solution. Your team have got access to this. As Linda said, you can put this editor at any time. You can create a bit of content. This is sort of a content development screen, if you will, but all of the icons, all of the functions in there, the majority of which you're already familiar with. You're using Word, you're using PowerPoint on a daily basis. There's nothing in there that's scary. The learning curve is relatively shallow, and you can be up and running with this in no time. But it's the power that it provides. As I say, everybody's using apps at the moment. Everyone's using the mobile phones as probably the main medium of electronic interaction beyond the workplace. Don't get me wrong. If you're sat at a desk for your role, you can access the internet from your machine. But for a lot of our clinical colleagues, they don't have access to the internet. They don't have a computer. They don't have a laptop. But they've all got mobile phones. So this is an ideal way, really, of reaching out and being able to provide them with timely information. And I think the actual sort of two aspects of this, the app and the editor, it is very powerful. A lot of people that we work with want to have that control. They want to be able to, share information with their colleagues quickly and easily without having to necessarily get IT people involved or comms people involved, which in some organisations can take, a little while to deploy or to get actioned. With this, it's probably easier than sending an email to your colleagues. You can just open up the web-based editor, type your information in, add images, links to websites, links to PDF documents, links to videos, and just send. And as Linda said, if it's something that's important, send a push notification with it. We're all familiar with push notifications, these little dots next to our favourite apps, or the little sort of header banners that we receive telling us about this, that, and the other. So why not do the same thing? People are looking at the phones, I think, on average 3 minutes. 3 minutes every hour, every day. So, a little glance here, a little glance there. If there's something new, something you want to share, then an app's an ideal way of doing that. Just a little bit about the process. So if people are genuinely interested, come and talk to us. We can have a team or Google Hangout. I can show you a little bit more. We've done loads of apps. As I said previously, I think we've got about 140 apps that we've created. We've got a whole raft of different patient, family and carer apps, right across the board for different conditions. Doing a lot of work with cancer networks at the moment, but we've done a lot of work with diabetes, COPD, green health, the whole dentistry, a whole heap of different apps. So we can show you different apps that different teams have created, just to to demonstrate the art of the possible, if you will. But we can have a little conversation. We can show you what we do. We can talk about what we're about. We can we can provide pricing. This isn't an expensive tool. It ranges anywhere between £5,000 and £15,000 per year to license the tool. And for what you're getting, it's not a massive amount of money, I don't think. We can go ahead and produce a free trial. We've worked in the NHS long enough to know that you as a team, as an individual, will need to go and demonstrate this to other people within the trust, within the organisation. So it's probably much easier to have your vision translated into a working app, which you can then motivate or get your colleagues to download, have a little play, and get familiar with the workings of how this all fits together. I think for us as an organisation, it's a much slicker, a much quicker approach. It gets the conversations flowing a lot easier. So it's something that we've found over the years is really key to getting the app idea, the app vision shared amongst your colleagues. As I say, we can put the app together. You can share that with, it's normally a 30-day trial, so you can share that with your colleagues, share it with patients, families, carers, depending on the focus of the app. As I say, we're doing a lot more workforce-related apps at the moment. So Linda's talked about international nursing, but we're doing preceptorship apps, we're doing recruitment apps, we're doing apps for student midwives, student nurses, induction type apps. So I think, you know, what people what trusts are recognising is, as we say, sort of Generation Z, the new workforce that's coming through, you know, are very much used to and wanting to use their phones and devices. They're wanting the information up front. They're wanting to be able to study this and have a look at it in their own time. And this just gives an ideal platform for you guys to be able to provide that information in a quick and easy and, you know, in a timely fashion. But we can create an app, and then you can sort of guys can, you know, send it or use it amongst your colleagues. Once we've got an agreement, you know, we can get the PO raised and invoiced, and then kind of, you know, off we go kind of officially. So this is meant to be relatively easy. The whole ethos behind Piota is quick and easy. It doesn't have to be overly complicated. It can be relatively painless and enjoyable in some instances, you know. So in terms of timescales, I think it's not a race, but I think one particular day, you know, at the start of COVID, we had a chief nurse come and speak to us, and they wanted to provide an app to their care home staff. They wanted to put all of the information about COVID and all the different PPE and all the different contacts and what to do in these situations. Obviously, you know, the whole world was moving quite quickly at that time, and they just wanted a way of communicating that directly to their care home teams. And I think we did it in one day. We've already got this platform. It's already within the app stores. It was just a matter of them getting some information from the client and being able to build the app with them, and they rolled it out. And like Linda identified earlier, you know, this is organic. You know, you can deliver it today, but you know, once it's out there, people start asking, can we put this on here and can we put that on there? So you know, it's continuously growing. A lot of the information will be static, you know, once it's up there, but you know, there'll always be something, there'll always be somebody, can we add this, can we add that? And it's, you know, for you guys, it's a dead easy, really easy, you know, proposition, because I say you can just log onto the internet, open up a page, create some content, press you know, publish, and out it goes. So really, really easy. Questions? I've not been able to see the console, so I'm just going to break off from this screen and see if we've got any questions that we can answer between us now. So let me just stop presenting. Chat, so look here. So just wanting to go through this. I missed the very beginning of, so, oops, I can't read that. Is that Jill? I've got GIL. I'm guessing that's Jill. What we're going to do with the presentation is we're going to edit this, and we're going to sort of post this onto YouTube. So what Lauren will do, the marketing team here at Piota, will write to you beyond today, and thank you for your attendance, and then there'll be a link to the video where you guys can go and review this again. And if you want to share it with your colleagues, please do. You know, share it far and wide, because I think everybody can benefit from an app in this sort of situation. What else have we got here? Please can I share my email address? Yeah, my email address is chris.elkin, sorry, no, that's my personal one, chris.elkin@piota.co.uk. But similarly, when we do write out to you, we'll put all those contact details in there. But what I would say is, if you are genuinely interested, just reach out to us. We can have a quick meeting with you. We can show you what the art of the possible. And then if you think, you know, there's a glimmer of hope that we can get it into your trust, we'll work together. You know, you've got a story to tell. I'll be your illustrator. We'll create you a little trial, and then you can then go and take that into your colleagues and show them, you know, this is how this could work. These are some of the challenges that we can overcome. Here are some of the benefits that this will bring to our organisation. So that's kind of what we do. That's how we do it. So thank you. Oh, that's fine. So if there are any more questions for now, as I say, Lauren will reach out to everybody, but don't be you know, please feel free to get in contact, and yeah, we'll see how we can help. But thank you all for your time today. Keep a lookout. We're going to be organising these webinars, these lunchtime webinars on a monthly basis. So please do keep a lookout for the next one. But thank you all for your time today, and have a good one. Thank you very much. Thank you, Linda, again.
Thanks, Chris. Thank you, everyone. Bye.
Cheers, guys. Bye-bye.
Bye.